So I wanted to give you a little bit of information. Healthcare for All Oregon is a 501c3 nonprofit organization. We have chapters across our state. We've been an active grassroots committee or organization promoting universal healthcare for over 25 years. And we have people all across the state that are working all the time to move us forward. Uh, and there's 20 other states currently working on plans for uh, universal health care. And I really feel like we're kind of at the head of the pack. So it's very exciting. And a couple of important dates that I wanted people to be aware of. In 2019, we were very fortunate to get the Oregon Joint Task Force on Universal Health Care going. And they spent a couple of years diving really deeply into the topic, looking at other states, what went wrong, what other countries do. And they presented their plan to the legislature in 2022. And then the legislature went ahead and put legislation forward for a governance board, which consists of 9 people who have been meeting for the last 3 years and talking about what this looks like for Oregon. There's 4 committees that are looking into all the details. There's a finance and revenue, a community engagement, an operations, a plan design, and pretty soon there'll also be one that'll be looking at transformation, how we get from where we are to a state-based plan. And the plan is to present this in the fall of this year to the legislature. So it's a very important time. We're trying to get out in all of our communities and get the word out about what we're doing and also help people understand that 58 other countries in the world have a universal health care plan. It's not a complicated, crazy idea. We have a lot of really excellent examples to draw wisdom from. And so we hope that you will continue to be active and part of our group as we move forward. I wanted to now give people an agenda for our candidate forum. We have 5 people 5 candidates who will be speaking tonight: Dawn Rasmussen, Mary Doyle, Rebecca Mueller, Peter Quince, Patty Snow, and I wanted you to know that we invited all candidates, Republican and Democrats, and this was the group that came forward. So thank you very much for coming to talk with us tonight. And I thought what I would do is start with the end of the alphabet first and kind of flip-flop so everybody gets a chance to be in a different order. And so I know you've just been here briefly, but are you ready to get started?
Sure. So it sounds like you're going reverse alphabet by the first name.
First name, yeah,
Okay.
yeah.
Sure. I'm happy to talk, and you can start my 3 minutes. So my name's Rebecca Mueller, and I am a rural pediatrician and a mother, and have spent 15 years in rural health. And a big part of a job of being a provider in rural healthcare is that you're not just a provider, you're also an advocate. All my career, I've worked with the vast majority of my patients have been Medicaid recipients. And so I know that population well. And increasingly, right now, as the ACA subsidies have gone away, I am having, for the first time in my career, an increasing population that are actually uninsured, which is a scary place to be. And it's scary for the families, and it's scary as a country to think that we're going backward. So certainly in terms of healthcare, for a long time, it's been very reasonable that we should be a country that provides healthcare for everyone. I do advocate for Medicare for all. I'm not against in the future having an actual public health system. Right now, our health system is so unwieldy that feels impossible. But starting out with a single payer health system as our first major goal And I love that in the state of Oregon, we actually have it directly in our Constitution that healthcare is a human right. I know we'll talk more about that later in our discussion, but for me, this the idea of healthcare being a core tenet of what's going on in our current election and our current political climate is part and parcel of what I deal with every day. So every day I have patients that are completely and 100% reliant on the Medicaid funds to provide for their health care. And I see the difference that makes in their life. When you don't have access to health care, not only does that cut you out of acute care concerns, it cuts you out of preventative medicine. Um, and as we know, what that does to our overall society costs and our overall health is detrimental. So we know that the United States pays more for healthcare than any other industrialized country, and we have worse outcomes than almost all of them on many different measurements. So I'm going to reserve time. I think we all understand what the issues are that we're facing, and I see them every day firsthand. So I'm really happy to be here and happy to be a part of the discussion. And thanks to you all for your passion in this topic.
So in terms of our order, the next person that would go by first name backwards alphabet order would be Peter.
Hi, I'm Peter Quince. I I come to this issue as a nerd. I've written numerous classes for professional education, online education on health insurance, and with a special focus on the Patient Protection Affordable Care Act, also known as Obamacare. In the classes, I approached it from the aspect of the legislative and regulatory rules, but also a description of how it came to be, how it's intended to work, and how it's working in fact. And the truth is, we already have universal health care. It's just that it's a terrible system. It's more expensive than it needs to be, and it works a lot worse than it could. When somebody shows up at the hospital, they receive care whether they can pay for it or not. And the hospital doesn't swallow the loss. They pass it on to everybody who can pay and to the insurers, which raises everybody's premiums. Meanwhile, you have people who wait to get treatment until their health is already deteriorated, which makes the treatment more expensive and the outcome worse. Well, in effect, we have the worst of both worlds. Costs are soaring and health outcomes are far worse than they should be, far worse than we're capable of providing, and far worse than we deserve. Nobody would start from scratch and design this system. I support Medicare for all. In order to get there, though, I think we need to start by making Medicare work better. We need aggressive enforcement of Medicare fraud, which costs us over $100 billion a year. We need to enhance the ability of Medicare to bargain with drug companies and change the payment structure so we focus on results and not on itemized charges. If we make Medicare work better, then it strengthens our argument that it should work for everybody in the society eventually, although we would probably phase it in. In some, this this election is likely to turn on the issue of affordability. And that means groceries, it means housing, and maybe most of all, it means healthcare. Everybody knows what's wrong. We just need to show them how we can make it better, how we can fix it, and that we do have solutions. Thank you.
So Patty?
All right, thank you. Thank you for inviting us to join you this evening. It's wonderful to have the opportunity to have a forum where we focus solely on healthcare. As you know, access to affordable healthcare is a top concern with the majority of Americans. And for nearly 100 years, attempts have been made to transition our country to a universal or single payer system. But while other countries and other developed nations have successfully created national healthcare systems that provide medical coverage for all of their citizens, the United States has become mired in a system run by healthcare monopolies that put profits over people. And it leaves almost 8% of our population without any kind of medical coverage because they can't afford it. And yet, the United States spends 18% of our gross domestic product on healthcare, which is more than any other nation, including all those nations that provide single payer or universal healthcare for their citizens. With the introduction of pharmacy benefit managers, healthcare corporations like CVS have managed to take control of our healthcare system. And with that, they have used their wealth to secure their position with our government. And this makes a change to universal or single payer healthcare extremely difficult, but it's not impossible. Current legislation that was put forth by Elizabeth Warren and Josh Hawley is a step in the right direction, but it's just a first step. We can't afford any longer to begin to transition to a single payer system. Given historic resistance to a single payer system in this country, I believe we could begin with a two-tier program like Canada and France use. And it combines basic healthcare coverage under a single payer model, but it has an option for private insurance for those who want and can afford extra care. It's time for the United States to join other developed nations who prioritize and value their citizens and understand that a healthy society is a productive society. So I look forward to answering your questions. Thank you.
Dawn, are you ready?
Or would that be me?
I think it's Mary. Mary's next.
Oh, I'm sorry, Mary.
That's okay. I'm here. Yeah, I'll go ahead and get started. So, hello, everyone. My name is Mary Doyle. I'm a 20+ year educator, mother and grandmother, and a partner with more than 2 decades in public service. I've managed large systems and complex human needs. I've also had a family member who depended entirely upon affordable health care coverage to protect our family from financial collapse. If I had not had a union negotiated insurance through Ben Lepine's schools, a single medical event would have wiped out our savings and we would have most likely been bankrupt. And so that permanently shaped how I view this issue. Healthcare is not an industry, it is a public good. The reason we have the most expensive system in the world with the worst outcomes is not inefficiency, it's by design. We have built a system whose primary obligation is to its shareholders. In 1973, President Nixon signed the HMO Act, which aimed to control the rising medical costs by promoting these prepaid, for-profit managed care. And it fundamentally shifted U.S. healthcare from a predominantly nonprofit system towards a profit-driven commercialized industry. So what do we have now? We have these private equity buys. They buy the rural hospitals and they strip them. We have the pharmacy benefit managers inflate the prices, and the insurance companies are denying care with their algorithms. And these vertically aligned conglomerates are billing at every step. And Congress allows it. So in Oregon CD2, this is not abstract. In Klamath Falls and Burns and across the Rogue Valley, access is shrinking. Rural providers are closing, and behavioral health capacity is really inadequate. And seniors are driving hours to see these specialists. Incremental reform is not going to solve this structural extraction machine. We got to move towards a publicly financed universal coverage, but we have to do this in steps. We have to break the vertical integration. We need to expand Medicare negotiation on all drugs, and we need to eliminate these surprise billing loopholes, and we need to protect our rural hospitals from these predatory acquisitions that they make. And we need to remove the profit incentives from the basic care delivery. Some candidates and the incumbent might frame this as making the system work better, but I believe the system is functioning exactly as it is designed, and that is to maximize revenue. So if we want healthcare as a human right, we must confront the financing structure itself. And that is the difference in my candidacy. Thank you.
And Dawn.
Thank you. My name is Dawn Rasmussen, and I'm coming to you from the Dalles, Oregon. Well, it's called a slow-moving train wreck for a reason. Our broken healthcare system is bankrupting families. It's causing great corporate profits. It's benefiting the pharmaceutical companies. Everything that could go wrong with our system is pretty much going wrong, and the money's going in the wrong direction. We have an opportunity here with a publicly financed healthcare system, universal healthcare system, to actually support people and not have them run the risk of catastrophic medical debts. And I actually was, just as an example, I was out in Baker City, which they have a pretty minimal hospital out there. And I asked everybody in the room, I said, hey, how many of you have helicopter insurance, like life flight? Every single hand went up in the room. That is absolutely stunning, because in that area, there's not a trauma unit. So if you get caught in a car wreck, or you're out working on the farm and you end up cutting your hand off, there's nothing there immediately that's within immediate reach. And when we have closures of healthcare systems that don't provide those necessary urgent care situations and specialists in rural areas, we have a problem. So that's why everybody's buying the long-term experience memberships with LifeFlight, because they can't afford, if their insurance doesn't cover it, a helicopter ride. And that is literally their only life-saving option. I believe in my campaign, as just in life experience, I'm not a doctor and I don't play one on TV, that we really need to look at options that are going to eliminate premiums, deductibles, co-pays, co-insurance, out-of-pocket expenses, and that will help us clear the way. But more importantly, what is really at the heart of the issues, we have to get money out of politics, because a lot of these medical companies, pharmaceutical firms, and et cetera, we all know the litany of the list. These are all folks that are influencing the lawmakers and keeping this really poor system propped up to support and benefit them, not the people, them. I am committed to working towards a publicly financed universal healthcare system. All the points mentioned earlier, I'm not going to recap those, but I believe that we need to become a much more healthy, prosperous community and society. And the only way we can do that is to provide the necessary healthcare to everyone as a human right, and also protect them from catastrophic medical debt. Thank you.
Okay, well, we went through that rather quickly. So thank you, guys. We're very well prepared, and we can move into our question and answer time. And some of the things that have been brought up will be part of the 3 questions we have. And we will hopefully have time for people, the participants of our forum, to put questions in the chat after these 3 questions are asked. These were questions that we, as a Healthcare for All Oregon group, decided were important to ask each candidate. So the first question is, and one of the things that I'm tremendously proud of, and being part of Healthcare for All Oregon put a lot of effort into, was being the first state in the country to get a constitutional amendment in our Constitution that healthcare is a human right, and to define that care as high quality, affordable, accessible care. And so we were the first, and I think it's a real important kind of basis to build an appropriate system with. And so the first question is, we have a constitutional amendment to provide cost-effective, clinically appropriate, and affordable health care for every Oregon resident. How do you see your role in Congress getting us to a place where we can provide that healthcare as a human right in our state. And one thing I want to mention is that the Kaiser Family Foundation this month reported a statistic that 4 out of 10 people in our country have either a medical or dental debt. So having coverage and getting care are two different things because, as many of the candidates have pointed out, the cost problem. Okay, so this time let's start. I know we just finished with Dawn. Do you feel ready to start and go the opposite direction?
Yes, I do.
Okay.
Ready?
Yes.
Okay, great. Well, as going into Congress means that I need to be a champion. That means advocating for restoring $11.8 billion in Medicaid benefits and safety net funding that has been cut. I also will work to bring back $117 million in COVID era grants to the Oregon Health Authority, which funds public health initiatives, crisis lines, and addiction treatment. I will also protect federal Medicaid funds and for organizations providing reproductive health services such as Planned Parenthood, and ensure continuous access to cancer screenings and STI testing. And finally, I will make sure that there's adequate funding from the U.S. Department of Education to train nurses and physicians to help ensure there are enough providers to meet our needs here in Oregon. Basically, I have to take whatever we can at the national level and then drive it down to the local level. Thank you.
Okay, Mary.
Yes. So in Oregon, we have our constitutional amendment, like you stated, and that is a moral declaration, but implementation requires our federal alignment. Congress controls the Medicare rules, the Medicaid funding formulas, the ERISA constraints, the HCAO waiver flexibility, and the drug pricing authority. So if Oregon wants to move forward toward a unified publicly financed care, we must secure expanded waivers 1332 and 1115 and federal cost sharing alignment as well. States cannot build fully universal systems while federal dollars are remaining siloed in DC. So my role in Congress would be to remove the federal barriers to state innovation, to secure funding parity so Oregon is not penalized for being ambitious, and advocate nationally for publicly financed coverage so no states are left carrying the burden alone. Some will say that this should improve access within the current framework, but the current framework structurally depends on employer-based coverage and profit extraction. So we need to change the rules of the game and not just expand the subsidies within it. Thank you.
Okay, so moving right along with our list, the next person would be Patty.
Thank you. Well, let me say I agree with what both Dawn and Mary said. I'm going to add to that, though. We have to get the big money that is currently being used by healthcare lobbyists out of our politics, because we can develop the best universal system or single pay system, but unless we can get it passed, it won't do any good. And right now, the corporate monopolies, the healthcare corporate monopolies, have so much money invested in our elected officials that getting them to vote against the healthcare system is going to be difficult. So the first step I'm going to take is to put forth legislation to get big money out of politics. And we need desperately campaign reform. Again, we have to stop that big money coming in to influence our elected officials. Otherwise, all these plans that we have are never going to come to fruition. So I agree with the plans that Dawn and Mary laid forth. And now we're going to take it to that next step, and we're going to get the big money out so we can move forward with these plans. Thank you.
Lori, can I just clarify? We have a minute for these responses. Is that right?
Yes.
Okay. The clock just was starting at 3 minutes. So I just want to make sure that we didn't
Oh, thank you,
the clock. Yes.
Rebecca, for noticing. Okay,
That's my bad.
Peter.
Yeah, Dawn and Mary and Patty all made really excellent points. What I want to focus on is just the language that we use. I had a friend named Evan Wilson who created an organization called Freedom to Marry. And he decided that instead of calling it gay marriage, if we called it marriage equality, and after he started to spread that term, within a shockingly short time, marriage equality became the law of the land. So that's why I favor Medicare for all, because I think that people have grown to see it as a natural progression, a natural perquisite of growing old. And I think that everybody who's below 65 would say, why are we not given that benefit? So I think that also we need to emphasize that Medicare is not free, that there's a premium, and that for most people, there's often a supplemental plan that they pay for on top of that. And that the outcome of Medicare for all will be cheaper premiums, broader coverage,
Peter,
and better
you're
outcomes. Thank you.
Okay.
I was done.
Okay. And Rebecca.
So I love all the things that my colleagues have talked about. I just wanted to say, on terms of a federal aspect, the first thing we need to do is have the political will to decide that healthcare is actually a public good, that it's something that the government should be investing in, that it's worthy, that it's valuable for us as a society to say healthcare is important, and we're going to put in the investment to make sure that that happens. One of the ways we can do that from a federal aspect is actually provide grants and incentives to states for looking into their own ways of doing public options for expanding Medicaid and even expanding Medicare. As well as they stand right now, but expanding as a step to getting to the point of a single payer health system. I also want to focus on the fact that we don't have access. So it's one thing to focus on payment, but when we don't have doctors, there's a lack of 13,000 primary care physicians today. There's projected to be a lack of 40,000 in the future. So the federal government also needs to be focusing not just on cost, but on access through incentives for those programs.
Okay, so we will move on to question 2, and I'm just going to scramble the names because it's kind of boring to go back up and down to the scale, so to speak.
We could do backwards and forwards from last name. That'll mix it up a little bit.
Oh, there you go. There you go. Okay. Why not? Except then I have to have my alphabet really smooth here. Okay. So the next question is, our current healthcare system is the most expensive system in the world, with worse outcomes, as many people have said already, than many other developed countries. This is in large part because of the influence of for-profit companies in our healthcare. Will you refuse campaign contributions from executives, lobbyists, and PACs affiliated with for-profit insurance, pharmaceutical, and hospital businesses? And I guess we can, speaking of, why don't we start with Patty Snow?
All right. This is an easy one. I don't even need a full minute. First of all, I'm not going to take any PAC money because you don't know where that money's coming from. And I will only take money from corporations or from businesses that I believe wholeheartedly in. And anytime that they are for profit, not for people, I will not be taking their money. So no, I will not take any of that money.
Then we would go to, let's see, you got a lot of people right there. Dawn.
Okay, perfect. Wonderful. Thank you. Well, as Patty said, not going to take it. I solemnly swear that I will not take any PAC or contribution money from anyone associated with these for-profit health systems, pharmaceutical, insurance companies, executives, lobbyists. I swear to you, because this has to be about the people. These people who are in those roles are absolutely not acting in the best interest of the public. They are acting in the interest of the bottom line. We have to focus on the people. Our country is a pariah in the Western civilized world, basically because we do not have a comparable medical system. And it's because of these PACs and lobbyists and all these influence special interests, they are damaging our country by refusing and standing in the way and blocking people from this. Thank you.
Lori, you're muted.
Okay,
So Lori
next person
is
would
me, I
be,
think.
let's see, I guess, Peter?
Yeah. I just wanted to say, that a sobriety test that they do use is to do the alphabet backwards. So it is challenging, I realize. So honestly, it kind of breaks my heart that there's such a large segment within the healthcare system that doesn't seem to want to fix it. I know that when Obama brought in the HCAO, they tried to bring the insurers and drug manufacturers and so on inside the tent because they thought it would be easier to pass the legislation, and it was. But the problem is that they ended up with a terrible hodgepodge that has become increasingly hard to manage and easier to attack by the people who want to destroy it. So I would love it if we could say, yes, we'll accept the money from them and then we'll work with them. But unfortunately, history suggests otherwise.
Thank you. And then we will have Rebecca.
Yes. So, no, I would not take PAC money. And I think the question also goes towards understanding who has outsized influence in these discussions when we're talking about the issues regarding healthcare. So the health insurance industry is a $1.5 trillion industry. Health systems, the actual hospitals and clinics that are providing the care, is another $1.5 trillion industry. And just for a little variation, the pharmaceutical industry is $1.6 trillion. But it's also really important to understand that in our healthcare system in the United States, there's two other sources of outsized influence, and one is specialties. And as a pediatrician, pediatricians are the lowest paid of all the specialties. Family practice doctors fall right behind us. And so when we're looking at why do we have a shortage of primary care, the fact that there's such high variability in reimbursement rates and that we are under valuing preventative care and overall wellness and overvaluing surgeries and procedures is a problem. The other thing that's really specific to us is that academic centers, especially in urban areas, also have an outsized influence on our policies, and rural people are just not invited to the table to discuss policies that affect us.
Thank you. And Mary.
All right. Well, yes, of course, I'm going to refuse contributions from corporate PACs and executives that are tied to the for-profit insurance companies and the pharmaceutical conglomerates, as well as private equity-backed hospital systems and those vertically integrated medical corporations. And this is not symbolic. Health policy in Washington is shaped by dependency. Members rely on the very industries that they are regulating. So we cannot credibly dismantle corporate medicine while financially tethered to it. And influence does not only occur through votes, it occurs through access and agenda setting and the committee relationships. So if we're serious about reducing the influence of for-profit medicine, we must begin with financial independence. So Families deserve representation that are accountable to the patients, not to the shareholders. And let's be clear, Cliff Benz has consistently voted in alignment with corporate interests. If we want change, we must break that cycle. And that also comes down to overturning Citizens United and getting dark money out of our politics. Thank you.
Okay. So now we will go to our third question. And it looks like we probably will have some time for one or two other questions. So you can start thinking about what you would like and put it in the chat as soon as we're done with this question. The third question is, and this was brought up a little while ago so I think it's important and it is one of our questions, so I'm going to bring it up again. Senator Warren and Senator Hawley have introduced the Break Up Big Medicine Act this month to limit the impact of corporate exploiters who incorporate pharmacy, insurance, and clinics under the same business umbrella. And what will you do to rein in the cost of healthcare in our country? And I know some things have already been brought up, but I'm, asking the candidates if they have another minute to bring up some other ideas. And this time, I guess we could go ahead and I think I'll just randomly select people. So the first one, let's do Rebecca.
Great. So one thing that's not often talked about in terms of cost to our system is that we actually allow overhead from our insurance companies. So the fact that we have people that pay premiums for healthcare with the goal of actually getting healthcare back and not just paying insurance companies is a great idea, but 20% of what they're paying, the insurance companies are able to utilize for their own internal expenses, which is how you get all these beautiful high rises in cities all over the US that have their names of insurance companies emblazoned on them, and how they are able to support special teams and professional teams and all of these things. So most European countries, the administrative overhead that is allowed is 3% in many countries, or the average is 3%. The largest is 7%. In the United States, we have 15 to 20% is administrative overhead. The larger five insurance companies are only allowed 15% overhead. But that savings to stop giving those insurance companies that money to spend inside would go a long way.
You're muted, Lori.
The next person to speak will be Patty.
Okay. I love the point that Rebecca just made. That's very important. But as we have talked about, we need to get the vertical integration out of our healthcare system. When you can have something like a CVS that owns every step of your medical journey, from developing the pharmaceuticals, the pharmacies that give you those drugs, the medical centers that prescribe those drugs, and the health insurance companies that then will repay you for those drugs. We need to cut the knees off on that, because right now there is no fair market. So moving to a single payer system would definitely be the answer. But in the interim, we have to get rid of the integrated healthcare system and bring fair trade back into our healthcare.
Okay. And Peter.
He's muted.
If you can't unmute Peter, I'll go ahead and we'll let
Okay,
Dawn
there
go.
we go. Okay. Yeah, I guess you guys were muting me. Anyway, what I was saying was that high health insurance costs are are a result of four factors: overtreatment, chronic illnesses, for-profit healthcare conglomerates, and large numbers of uninsured. So addressing the first two issues, I think what we need to do is work towards a whole patient approach where compensation is based on outcomes and not on the number of tests or procedures that you use. What that will do will incentivize treatments and healthcare and physicians to be proactive and to highlight preventive care and avoid unnecessary tests and procedures, which will end up in being lower cost, better outcomes, and just a better focus for our healthcare. The hope is that it'll also diminish the number of chronic illnesses because of the emphasis on preventive care and healthy helping with healthy habits rather than post-illness treatment. Thanks. Was that, yeah, that worked,
Yes.
right?
Thank
Okay.
you. Dawn?
Okay. Moda Center, Providence Park, Highmark Stadium, Baycare Ballpark, Atrium Health Ballpark. All of the things that Rebecca's nodding her head. These companies are paying and putting their name, it's a vanity project, on the sides of buildings for sports teams. When we think about multi-million-dollar 10-year deals, it is so important to look at that money right there and say, why is that money not being put to the good of the people versus a sports team and a vanity project? Okay, Section 3 of this bill explicitly prohibits people from having anti-competitive ownership. I believe is the fiduciary and legal due diligence of every elected member of Congress to regulate, investigate if necessary, and prosecute if necessary any violators. Thank you.
Okay. And one more. Go ahead.
Yes. So yes, the consolidation of the pharmacy benefit managers and the insurers and the hospitals and the clinics under that single corporate umbrella is one of the primary drivers to these cost inflations. And like just what Dom pointed out, that's why they have all the money to do these things. So I absolutely support the framework because that vertical integration allows for price manipulation at every single stage of that care delivery. But we must go further. We must strengthen our antitrust enforcement in healthcare. We must ban anti-competitive contracting practices. We must expand Medicare's negotiating authority to all drugs. And we've got to cap hospital facility fees so they're not taking profit out of that step as well. And we have to increase transparency in these rural hospital acquisitions. So corporate medicine extracts profit at every step. We must remove the profit from as many steps as possible. If we don't address the structural consolidation, the cost controls will always be temporary.
Okay, so we've answered those three questions. Thank you. And we have time to, probably if we continue with the format, there's a couple of questions in the chat now that we can pose to the candidates. And so one is Dr. Dave Gilmore and the other is Fernando Capison. So why don't we start with Dave? Why don't you present your question?
Okay. Yeah, as one who was in a past life a former health officer for the county for 15 years. And 50 years ago, during my medical training, I was in Ethiopia and actually saw kids die of smallpox and polio, measles and diphtheria, pertussis, and all these diseases. And I'm really concerned about the degradation of public health, especially under the Trump administration, with CDC just falling apart right before our eyes, and the end of foreign aid programs that really promoted HIV medications in Africa and other things. I'd like to really encourage all of you that if you do have that fortune, if you're fortunate enough to get into that office, to not forget public health. And that's, I think, a very important thing for all of us to think about. Thank you.
And I will say, you can all respond to how you might approach the public health concern in this country. And with that, I would have Mary go first.
So to me, public health is national security. Disease doesn't respect borders, and underfunding our global vaccination efforts is both morally wrong and it's really strategically reckless as well. So Congress must fully fund global vaccination partnerships and our pandemic preparedness programs that have been absolutely, just eviscerated, and our domestic public health infrastructure. And when we cut foreign aid in vaccine distribution, we don't save money. We create variance and instability and more long-term costs. And vaccines are one of the most cost-effective public investments that were ever developed. So I support fully funding CDC and NIH research, strengthening our global immunization partnerships, and expanding rural vaccine access within our own district. We got to combat the misinformation with science-based policy as well. Some politicians treat foreign aid as charity. It's not charity, it's actually prevention. Thank you.
Dawn?
Okay. We have a complete nut job in the Health and Human Services. He's absolutely batty. I'm being polite. When we have someone who's actively trying to defeat and remove vaccines, meanwhile, measles are spiking. And we have other global variants there's a new flu out now. And there's obviously going to be more and more pandemics happening. And when we have people that are actively fighting against science and fighting against, proven methods of solving major health crises and cutting public health education and services, it is leaving our population vulnerable. And meanwhile, the people that are in power are using their own means to get their own vaccination. So it's hypocritical.
Now, Patty?
Let's remember that in Trump's first term, when COVID became rampant, he was suggesting to people that they drink bleach. So and look who he did assign to be in charge of health for our country. We need to change the way that we bring someone in to be our number one health care advocate. And we need to be not only supporting public health care in the United States, but we need to reinstate institutions like USAID, because as Mary said, diseases don't know borders. We need to make sure that we are using our technology to prevent these catastrophic pandemics worldwide. And we need to rely on people, doctors who understand the truth and medicine and aren't just coming up with fake prognosis.
Peter?
So I was born in October. The following June, my mother contracted polio. It was the very last wave of polio before the Salk vaccine was introduced. If what I wouldn't have given for that vaccine to have come out in time for her. It was such a cruel illness. And as she got older, she suffered from post-polio syndrome, so that her muscles started to deteriorate. And by the end, she looked like a concentration camp victim. So anybody who makes money, makes a career like Robert Kennedy Jr., makes a very, very, very lucrative career out of convincing people that vaccines are harmful. Not just that they don't work. I don't understand the cruelty of that. And what we need is empathy, what we need is care, and what we need is understanding, and for people to see that we do care. And that's why we want to help them in this area. Thank you.
And Rebecca.
So I actually have my master's in public health and community and behavioral health. And the number one thing about that as a background is that it was in my public health degree that I learned that no community is so broken that it can't participate in its own healing. And I love the fact that through public health, I learned to listen and to involve people collaboratively and their own solutions for their own health. On the other side of public health is well beyond vaccines, right? When we're talking about public health, we're talking about the ways that communities interact with things that affect their health. And I actually have to say that I really love a lot about what the MAHA movement is about, not on the anti-vax part, but in asking questions about what is truly healthy in our food supply, what's healthy in our water supply. Let's get down to the bottom of the plastics that are in all of our foods. So I actually appreciate some of that background. Don't like the trash that comes out of the anti-vax side, but would really like to actually take that initiative and run with it in terms of getting us back to a responsibility for those other things.
Okay, we are getting quite a few questions. We probably have some time for a couple of more in honoring the order. Fernando?
Yes. Can you hear me?
Yes.
Okay. This question might sound like trivia, but it has to do with how much any of the candidates know about healthcare for all Oregon. I was actually active in healthcare for all Oregon before it was healthcare for all Oregon. And we used to watch films about what strategy we should take. So this question is twofold. One is, what is unique about the way that Canada achieves single payer? And who is Tommy Douglas?
And so what I would say for the candidates, you can all respond, or if any of you would choose to, I don't know.
Can I take a guess? My guess is that Tommy Douglas is the guy who created or helped create the healthcare system, the universal healthcare for Canada, and that when they decided to honor the best Canadian of the century, I think Gordie Howe came in second, or maybe it wasn't him. Maybe it was who's that other guy who scored all those goals? And this guy came in, the founder of Healthcare for All was the one who came in first. Am I right? Did I get it?
Well, you're close.
Oh,
It's a two-part question, though.
So
Can I answer?
I was just going to say I cheated and looked it up, but yeah, someone else can go if you want.
Okay. Thanks.
it's not cheating. It's using the resources.
Yeah.
Let's give some turns. I think, Peter, you had your turn.
Oh, no, I know.
Okay.
Okay.
Well, to answer the first part of the question, in Canada, they use a two-tier system, as I mentioned earlier. So they have the single payer system, and then they also have private healthcare that you can purchase for additional care. And I believe, if I am correct, that Tommy Douglas I think they nicknamed him the father of socialized medicine. Is that close? Which, by the way, I'm not in favor of socialized medicine, but that's okay.
Anybody else want to offer anything more for that? We can move to the next one.
Well, I actually love this question because it made me look into this a little bit, but that is actually exactly what I was talking about with incentives. So what Canada did was what was unique to their system is they started one state at a time, each state working towards its own kind of experiment and working towards public funding for universal health care by state. And the first state to do it was Saskatchewan, and that was under the leadership of Tommy Douglas. So, but that actually goes specifically to what I was talking about, where the federal government can actually incentivize states, and then each state can utilize, we have very similar ways that our private, for-profit health systems work in each state. And so the number of ways that we can solve those issues are varied, but one of the things we can do is incentivize different states to look at different solutions, and then as a nation learn best practices. And I was distracted for a second because someone texted me to make sure I knew that there were provinces in Canada, not state, but I think the parallel still applies.
Great. Any further comments?
I'll add on a little bit to what we're all discovering is that the key lesson with Canada is they separated the finance from the delivery, right? So the doctors and the hospitals are mostly private, but the billing is public and universal. And like Rebecca was saying, it's per province. And so it dramatically is lowering that administrative overhead, and it eliminates that insurance profit driven layer. That's where that corporate comes in, right? We're more complex, but the principle can still hold. And I think that's why Healthcare for Oregon can be the template, just like in Montana, they can be the template for overturning Citizens United. I mean, we need to recognize our states' rights. If it's not within the federal government's purview, we have the right to do these things, and we need to be on the forefront of it. And it's kind of a structural lesson for us. Canada they have like universal coverage, but it doesn't require the government run hospital.
Thank you. Any further comments?
This is Dawn. Can you see me? Okay, there we go. Okay, perfect. Okay, great. Well, I think one of the cool things is that in a way, the Oregon is setting the standard, as we've already talked about, that other states are following our lead. And that's pretty much, again, what happened in Canada. That started out in Saskatchewan, and then it became like kind of the domino effect, and then it became a national model. And, I'm pretty excited. I've been staying on top of this actually for quite a while. I was on the North Wasco County School District Board, and Dr. Judy Richardson, she's been on the governance board, I believe, with the state. And so it's been exciting to see how this idea has been growing and being built upon. And we're on the cusp of becoming that cutting edge, setting up the template that can be used for the rest of the United States, similar to what happened in Canada. Thank you.
Okay, great. I think we have time for one more question, and I'm going to turn it over to Bonnie Ankle.
Hi, my name is Bonnie Ankle. My question is about funding. No one mentioned how funding, and traditionally, the federal government either wants to tax the people for these services, and I'm hearing a lot. So I work for a very large universal healthcare, a university hospital system that also has over 14 medical training centers, and I remote into work, and I am part of a task force identifying different funding resources because the state that this university is in is considering almost the same thing as Oregon, and we are running different computer simulations. And so the third way, instead, we can either tax corporations, we could either tax the people for this service, or we could do a taxing of the businesses per quarter, depending on their shareholders. So when their profits hit over a certain ratio, a percentage of that would go directly into healthcare, and the way that our task force is looking at that is all the people in a state who's not a billionaire is part of the labor force, and our corporation should be supplementing the healthcare for our labor force. part of this is a lot, but I want to know, how would you fund these initiatives federally? How would you like to fund them federally?
Peter.
As everybody knows, Medicare is funded by part of the FICA contributions that are made, it, which is one reason why I think the plan, the system is so widely popular, is because people feel like they have already bought into it, that it's their money that's helping to create it. So I think we need to build on that model. Employer contributions that go along with FICA. I think we have to rename Medicaid, because people confuse Medicare and Medicaid. One of them has to change their name so people understand that they're not the same. Because part of what you're talking about, the funding issue, is funding of Medicaid, which is definitely at least as important, just different financial basis for it. So, thanks.
Dawn.
Well, I think it really boils down to the elephant in the room. We are fighting over mere morsels when we have people and corporations not paying their fair share in the tax system. And so I believe that we need to come up with a progressive income taxes based on people's ability to pay, payroll taxes on businesses, and also allocating existing government funding. It has to be a trifecta. It shouldn't be either or. We've got too much to pay for and not enough funds right now to pay with it. So it's going to be very important that we focus on coming up with as much money as possible and making the people accountable that should be paying their fair share instead of burdening the rest of us with that. Thank you.
Mary?
Yes, hello. Yeah, like Dawn was saying, it's progressive taxation. I mean, we're already funding it now. We just fund it really inefficiently, and we're funding the corporate profit along the way. I mean, as others have said, we spend more per capita, and that's just absolutely ridiculous. And it goes to insurance profits and executive compensation and shareholder dividends. And we need to hold those people accountable by a system of taxation that treats the worker more as the person who deserves the wage than the one who is sitting on the C-suite or on the boards and who are structuring their life in a way that they never pay taxes. So it's not a funding shortage, it's actually extraction. So with moving towards a single payer system, obviously is going to take a while, but we can finance it by redirecting what employers and families are already paying in their premiums and their deductibles, like perhaps into a unified pool, while eliminating that profit layer and much of that administrative waste. Because as I think Rebecca was, I'm not sure which one said, but addressing administrative waste as well.
And Rebecca.
Yeah, so I think to start with, we can just start with taking the amount of money that people that are employed and their employers are paying towards benefits, towards premiums, and putting it into a pool. I actually think we can do that pretty quickly. One of the strategies in terms of a stepping stone to universal healthcare is to actually make health plans portable. So instead of having your health plan come directly through your employer who's bargaining with the insurance company, we can have those accounts just go through the same Affordable Care Act marketplace. And that way the employers pay into it and the employees can pick a plan that works for them. But then their plan itself is not tied to their employer. It's something that they're contracting individually. And you can start to offer state by state a public option that some of those employer funds can fund the public option, and people can opt into that if they want, and it creates a nice transition. So, and then of course tax base will be for those that are not employed.
And Patty.
Thank you. First of all, Bonnie, I would love the chance to talk to you at some point to see what ideas you're coming up with. And I'm also interested to see how the Oregon Health Plan decides on funding everything. We don't have all that information yet. There's going to be a great savings for corporations if we go to single payer healthcare or universal healthcare, because right now they are having to hire people to process all of these claims, which as a business owner, I know is incredibly expensive. And as Dawn brought up, we also pay for our insurance. Even the insurance we get through work, we're having to pay for. So this is going to be a multi-step. Yes, there will probably be an increase, or there will be a federal tax that will cover part of this. There's also going to be corporate taxes that need to pay for this. But we have to realize the amount of savings we are going to have, and therefore paying the extra tax will not be painful.
Well, thank you. With that, we are going to end the question and answer period because we are drawing close to 6:30. And I am going to have Sarah Spansel take over from here. She will place the order for people to make their closing statements. I have a family emergency I need to attend to. So, are you ready, Sarah?
I am here. Yes, go tend to that, Lori. Thank you so much for doing this and setting it up. And yeah, go tend to that.
Thank
So,
you, everyone, for coming. Since I have to go now.
So we're gonna start the 1 minute closing statements now. I wasn't really tracking orders, so I am going to choose randomly now, if that's amenable to everyone. And since Peter, you are first on my screen, I'm going to start with you.
Just to revisit the finance question briefly, I earlier cited a figure that there was roughly $100 billion a year of Medicare fraud. We need to modernize our enforcement and recover that money. But also, we need to look at where the problem is, which is the Republican Party seems intent on dismantling the system that we have, as creaky and problematic as it is. They want to make it worse. They want to hobble it. The answer is we need to vote. We need to have people vote. We need to have so many Democrats or independents who are with us in Congress that we can vote for these measures. Whatever the influence of money is in Congress, it's obviously far more on one party than the other. So the answer is we need to have the candidates, and we need to have people go out there, support those candidates, and vote.
Thank you, Peter. Next, excuse me, we'll go to Patty Snow next. Thank you.
Just to clarify, these are 1 minutes again, right?
Yes, that is correct. Thank you.
Thanks, Sarah. One of my favorite things about running for this position is I have had to learn a lot about a lot of different topics. And none of us can be experts in every area, but what we can do is seek out the experts and learn from them and gather ideas. So I appreciate everything I have learned from the fellow candidates, everything I've learned from the questions you have asked. And even if I did not have a full answer for you today, I promise you I will have. Because this is a topic that is top on the list for everyone in this country. Thank you.
Thank you so much, Patty. And next we will go to Dawn.
If you want a fighter who's going to fight for everyone's health care, that would be me. I believe that we have to have a healthcare solution for this country that makes and fulfills that promise in our U.S. Constitution, and that we will create a society where everybody has the liberty in life and the pursuit of happiness. We cannot pursue happiness and we can't enjoy our lives if we're ill and destitute and suffering from catastrophic medical debt. I'm prepared to take on Cliff Bentz and fight for the people, not corporations. This is not the United Corporations of America. We are the United States of America. I am a fighter. I will champion healthcare for all every step of the way. Am I a doctor? No, that's Rebecca. But I will tell you that I am committed to doing everything I can to learn all the key pieces to this very important piece of American society and where we need to be spending our money and our time and our energy. You can count on me to do that. Thank you.
Thank you, Dawn. And next we are going to go to Mary.
Oh, hello. Yes. So to me, the central question is, do we believe that healthcare is a commodity or a public good? If it's a public good, then it cannot depend on employment status or your income bracket or corporate profitability for that. And in Oregon CD2, it's rural, it's aging, it's medically underserved, and we cannot afford any kind of timid reform. In our district, more people rely on Medicaid than actually voted for Bentz. So we need structural courage. I'm not running to manage corporate medicine more efficiently. I'm running to challenge the system that allowed it to dominate in the first place. Healthcare as a human right requires financial independence from corporate influence. We have to have federal state alignment. We have to have antitrust enforcement. We have to have public financing expansion. And we have to have a willingness to confront this consolidation directly. And that's what I'm going to do in Congress. And I'm the one who can bring the fight there. And that's why I think I'm the best candidate. So if you can, and we have questions on my website, contact me. Let's have a conversation.
Thank you, Mary. And I thought I was unmuted. Apologies. And finally, we will go to Rebecca.
So as I mentioned at the beginning, so much of our conversation about healthcare really focuses on cost, but really there's crumbling issues in terms of cost and quality and access. And you can probably add in their infrastructure as well. And so why are we so behind? And I put it before you that we have been behind on healthcare for 30 to 40 years. Our politicians have been coming to us with speeches, coming with ideas, coming with all sorts of innovations to solve these problems, and yet we're still in the same place. And because we can't even figure out the cost issue, we haven't even started to look at access, infrastructure, and quality, or at least not nearly as much as we should. And I put it before you that the reason we haven't made progress is two things. One, we've talked about special interests and money, but I also think the thing that keeps us from making progress is our hyper partisan politics. And although I am an advocate, I would not say I'm a fighter so much as I'm solutions focused. And that solutions focus allows me to work with people across the aisle to come up with solutions and make progress. Thank you.
Thank you, Rebecca, and thank you to all of the candidates and all of you participants for coming to this Zoom tonight, this Sunday night. I would like to invite all of the candidates to be sure to put your contact information, your websites into the chat so that if folks are interested, they can click through. Just some other announcements. I'm sure Lori had some more closing comments put together for you all, but just some announcements of some upcoming events. The next meeting for the Healthcare for All Oregon Rogue Valley chapter will be April 12th at 5 p.m. And if anyone needs any information on these meetings, please go to hcao.org. You can find out about all upcoming events as well as support the organization there. We are looking for volunteers at the end of March for the No Kings rally to give people information about healthcare for all, as well as to potentially get them to sign up to receive our newsletter. We will be at the Pear Blossom Festival. We are also hosting.
The motor doesn't turn on.
There we go. We are also hosting Rogue Valley Town Hall on Universal Healthcare and the Universal Health Governance Plan Board, the UHPGB. Will be on April 26th, and that'll be in person at the Medford Library from 12:30 to 2:30, and we are going to have representatives from HCAO. We will also have representatives from the UHPGB speaking, so that's another great in-person event for everybody that I hope you'll be able to attend. And then we are also looking for folks to table with us at the Jackson and Josephine County Health Fairs on April 18th. So feel free to put any of your contact information into the chat if you want further outreach too, because we'll be able to see the chat later and go through that. So any other questions or if you need people to reach out to you, please don't hesitate. But otherwise, thank you again so much for taking the time and for all of you candidates for stepping up to run. I know it's a, huge lift. It is not easy, especially in one of the biggest districts in the country. So thank you for taking that on and doing what you're doing, all of you. And I will give you an extra, looks like 8 minutes back to your Sunday evening. So thank you all and have a great rest of your evening.
Thank you, Sarah.
Thanks, everybody. It was wonderful. Really excellent.